U.S. Department of Health and Human Services put out a regulation back in 2010, and they listed 2.2 million entities who could have access to your medical records without your consent as a result of HIPAA.
Twila Brase is with us. She's a registered and certified public health nurse who co-founded Citizens Council for Health Freedom, a national organization based in St. Paul, Minnesota, that advocates for healthcare choices, individualized patient care, and medical and genetic privacy. She's widely recognized for her Health Freedom Minute. Her radio show featured heard over 780 stations nationwide, and for her book, Big Brother in the Exam Room: The Dangerous Truth About Electronic Health Records. Please welcome to the show, Twila Brase.
Well, thank you so much. I'm glad to be here.
Come on, I'm covered with HIPAA. I don't have to worry about anything. I just got an operation on my kidney, and I saw a HIPAA thing, so I'm covered. What do I have to worry about? Nothing.
Nothing except the fact that HIPAA doesn't protect your privacy, but other than that, no worries.
Tell people how HIPAA does not protect your privacy.
Yeah, so HIPAA is actually considered a permissive data sharing rule. And so despite those things like, going to the pharmacy and being told to stay, 10 feet behind, or even doctors being told not to talk about anybody in the elevator, all of those sorts of things, really the fact of the matter is underneath, they are able to share all of this data in your records without your consent. And so the U.S. Department of Health and Human Services put out a regulation back in 2010, and they listed 2.2 million entities who could have access to your medical records without your consent as a result of HIPAA. So it is not a privacy rule.
So it seems like, correct me if I'm wrong, that's the exact opposite of what people are led to believe what HIPAA does, because I thought HIPAA protected my privacy from those how many millions of agencies that the bill actually. So how come no one has reported this?
Well, we've been working for about 15 years to get people to refuse to sign the HIPAA form. We call it a deliberate deception, and one of the largest deceptions ever foisted on the American public. So my book, Big Brother in the Exam Room, actually tells the story about everybody who wanted access to that data, how they got access to that data, and then how they digitized it all with the electronic health record mandate. So once they had permission to share it without consent, then they digitized it, and then it was readily available across the country.
So, I mean, this is outrageous. I mean, and what's even more outrageous is that I do a show like this. I've been operating in the health freedom space for at least since COVID, which is what woke me up to all this. I didn't know anything about this. I always thought the exact opposite, that I was protected from my medical files being shared. My medical privacy would be private. Is there anybody in Congress that is on board with you and has been talking about this?
Well, I'll just tell you that you are in good company. About 6 or 7 years ago, we went and had 22 visits to 22 offices. And we asked the staff of all of these members of Congress, what does it mean when you sign the HIPAA form? And to a person, almost using the exact same words, they said, it means that my medical information is between me and my doctor. And then, of course, we had to tell them that's not actually the truth. The HIPAA was a way that the people who wanted your data got access to your data and didn't have to ask your permission, use it for all sorts of purposes that you don't have any idea that they're using it for. And then you also don't know about the e-health exchange, which was created by the government, funded by the federal government, and has much of the industry from 37 states sharing information. And so, like, if you live in Washington, D.C., let's just pick that, and you go and you take a vacation to Florida and you get hurt and you get into the exam room and the doctor or the nurse or the clerk or whomever it is says to you something like, are you still taking XYZ medication? And you look at them and say, I didn't tell you anything about that. How would you know anything about that? Oh, we have access. Well, they have access often through the eHealth Exchange, which is at ehealthexchange.org for anybody who wants to look up and see if their doctor, their clinic, or their hospital is part of the exchange.
So it's are there big swaths of hospitals or medical providers that aren't a part of that exchange, or does that cover most healthcare providers?
Yeah, so I'm thinking about the statistics that you find on there, which I haven't looked at for a little bit. But I know that I think it's 70% of the clinics, or no, I think it's 70,000 clinics, and maybe 75% of the hospitals. They have it right on their website. I'm just not looking at it at the moment. They have a majority of the kidney dialysis facilities. They also have most every state health information exchange. And people don't understand about the state health information exchanges either. But that is often how the doctors and the hospitals within the state share information through the state exchange. But the state exchange is often also on the eHealth Exchange. So it is this one big national healthcare system. The data is not centralized. It is still where you got your care, but all the portals to those records are open so that someone in one state, a doctor in one state, can go get the data that you got in another state because all of the portals are open.
So what about like Planned Parenthood? You would think that would be a big issue for them to keep things private. Are they a big subscriber to this this sharing?
That's an interesting question. I do not believe I have seen Planned Parenthood when I have looked through some of the states just to get an idea of who's in there from a state. And I would guess that they wouldn't, because that would make that information all the more open to all sorts of viewers. Because the fact of the matter is, once they digitize the data, everything that's in your medical record and whoever has access to your medical record, really the only thing that's keeping them out of there is the fear that they'll be caught if they didn't have a reason, to look at the data. But even the people who have a reason to look at your medical records get access to all sorts of data that you don't expect. So I heard once from a physical therapist who told me that as soon as a patient gets physical therapy, they get access to the records. And so they'll see things like, all the diagnoses, or the sexually transmitted diseases, or the cancer treatments that they're getting that the patient hasn't even told them about, because the patient doesn't want them to know. But it doesn't matter because the physical therapist has access because they're treating the patient.
So this sounds like someone could compromise someone through something like this, like a blackmail or have you are any real world examples of something like this happening?
So, we've thought about that, and we've wondered if there is a real world example, how likely is it that somebody will talk about their real world example?
Right. Yeah.
Right?
Okay.
So I think that we don't know, but if you consider the fact of all of the hacking that's going on, so my book will talk about the wall of shame. So the U.S. Department of Health and Human Services has a wall of shame, which lists that every entity that has been hacked or have had a breach, or somebody on the inside has taken the data and it's been discovered, right? But I also talk about the fact that I believe they think it was Russia or Korea. No, I can't quite remember my own book, but it's been 6 years since I wrote it. But one of them is the one who got into the Office of Personnel Management in the U.S. government. And they got like the fingerprints of I don't know, 1 million people, and they got the data from all the other people, right? And so it was a foreign actor that got in and got all that data on all these government employees.
Oh, okay. All right. So what if I don't sign the HIPAA form the next time I go if I get admitted to an emergency room and I need an emergency procedure, that just happened to me a few weeks ago. I need an emergency operation on my kidney. what if I don't sign the HIPAA form? What happens?
So it depends on who your, what clinic or what doctor you're seeing or what hospital, how much they know the law, because the law does not require you to sign the HIPAA form. And as a matter of fact, the U.S. Department of Health and Human Services, on their page explaining the notice of privacy practices, which is really a notice of disclosure practices. Anyway, on that page, they say, by law, you are not required to sign the form. And it also says that if you refuse, the clinic, the hospital, whomever, they are the ones that have to document that you refused. You do not have to lift a pen or click a button. But a lot of them have been told by their attorneys that if you do not sign, it will be a HIPAA violation. That is totally not true. And so for some people, they end up with someone who refuses to let them not sign. Essentially, it's going to send them home if they don't sign. And I say, live to fight another day. But in all of the time that we have been running this campaign to get people to refuse to sign, we have seen changes. Fewer people are being turned away. We just saw a consent form that actually said at the signature line, because it's about the notice of privacy practices. And it's sometimes embedded in the consent form, and it's sometimes its own form. Anyway, this particular form said, and I think even in bold letters, you are not required to sign this. That is the first time that we have seen that in 15 years. But the message is getting out there because people around the country are refusing to sign, and these clinics and hospitals are trying to figure out what to do. And then they're finding out that, their attorneys told them the wrong thing. And no, people are not required to sign. And so whether you sign or not, they can share the data under HIPAA. But now you know that you don't have to do it. They have learned something. And the entire thing is being exposed that it is not about privacy at all. It's not about protecting your privacy at all. It's all about, have you read, received, or understood the notice of privacy practices? And that's what you're signing. Have you read, received, or understood it? But if you look at it, it tells all the places that your data will be shared without your consent. And most people just believe the word privacy practices, right? And they never look.
And so, so if I don't sign the HIPAA form, is that going to, negatively affect the treatment I'm going to get? Like, is there a, is there a real need for this in treating me in a health setting?
Absolutely not. Because as I said, this is a permissive data sharing rule. Whether you sign it or not, this is just a ruse. It's part of the deception. Getting you to sign that form is part of the deception of making you think that HIPAA protects your privacy. So it's all a ruse. So they have the right to access your data under HIPAA without your consent, whether you sign the form or not. But we do ask state legislators to change this, because if a state passes a real privacy law, that supersedes HIPAA, and suddenly your consent is required before they can share the data. And that's how it is here in the state of Minnesota, where our organization is located and where we have had to fight to save our privacy law here against everybody that wanted to repeal it. So, and I should say that if you go to our website, which is cchfreedom.org, Citizens Council for Health Freedom, right? cchfreedom.org. And you just go down the homepage about 3/4 and you'll get to helpful handouts. And there's one called discharge instructions. And it's our way to discharge you into the world of healthcare with some information that will help you. And there are 6 ways that you could be presented this HIPAA form. And we tell you exactly what to do to refuse to sign.
And so have you had an instance where you personally refused to sign it?
Oh, many, many times. So I was once at a doctor and I refused to go through the entire questionnaire. I'm like, you don't need this for my appointment here. And then I brought it up and they said, well, you can't finish registering if you don't fill it out. And I said, give me the manager. So the manager comes out manager fixes it so that I don't have to do it. Then the manager comes with the HIPAA paperwork. And I said, I don't have to sign that either. She goes back to the doctor and tells the doctor that there's this woman and who's out there refusing to sign the HIPAA form. Now, he knew me. And he said, is it Twila? And I said, yes. I know. And she said, yes. He said, send her in. But nobody should have to be known like that by the doctor. Alternatively, I was at another appointment where they refused. And I said, by law, I do not have to do this. And the manager said, I don't care whose law it is. We have our own policy. And so I left. I got my money back and left. But leaving, that's the only time I've ever had to leave. But like I said, if something is urgent, or you think you've got cancer, or you've got a child and you finally got the child in, right? Live to fight another day. We are definitely making progress on this, but it would be great to have Congress actually move on this issue.
Hey, I don't know if you can tell, but I'm getting older. Yes. And I'm even starting to lose my hair, which you probably can't tell because I'm wearing pants. But the point is, we have a new thing to help you aging. It's introducing Qualia Senolytic, the first of its kind formula designed to help your body naturally eliminate senescent cells. This is a big deal. They've been working on this forever. Senolytics are a science field revolutionizing human aging. A big culprit behind that middle-aged feeling can be senescent cells, also known as zombie cells that linger in your body after their useful function, wasting your energy and resources. The accumulation of zombie cells can lead to less energy, slower workout recovery, joint discomfort, and basically just feeling old. Well, here's how it works. You take it just 2 days a month, helping your body naturally eliminate zombie cells to age better at the cellular level. You experience the science of feeling younger. So if you want to experience the science of feeling younger, go to quallife.com/Dore for up to 50% off your purchase and use code Dore for an additional 15% up. That's QUALIFE.com/Dore for an extra 15% off your purchase. Your older self will thank you. And thanks to Qualia for sponsoring this episode. Hey, come see us on tour. We're going to be in Toronto, Red Bank, New Jersey, Northampton, Massachusetts, Concord, New Hampshire, Oxnard, California, Rutherford, New Jersey, New York, Edmonton, Calgary, and Vancouver. Go to jimmydore.com for a link for tickets.